Hi everyone! Kumusta na kayo? I hope you're all doing well. So for today's video, I'll be sharing to you about what are the must-have skills and common tasks of a healthcare virtual assistant. Number 1 is integrity. As a healthcare virtual assistant, we need to be trustworthy because we have direct access to patient information and those information are confidential. Next is excellent communication skills. As we answer phones or we communicate via email, we need to effectively communicate with our patients, with our team members, and even to our clients. Number 3 is empathy. Studies demonstrate how empathy improves patient satisfaction, treatment compliance, and clinical outcomes. When we usually speak to our patients, they are usually in the state of distress. That's why it's very important for us to speak with them with empathy. Number 4, ability to multitask. It is very important for us virtual assistant that we're able to multitask or work efficiently because our goal is to be able to address the concerns of our patients as soon as possible. Number 5 is it is important for us virtual assistant to be organized. Organized with our tasks, organized with our thoughts. It is important not to put our mind all over the place. We have to have presence of mind because it is vital. Patient's information, patient's concern are vital. And if you mistakenly, for example, put one information to another patient, then it may cause a problem. As a healthcare virtual assistant, you also have to be HIPAA certified. So it's part of the compliance of your practice. So you have to be familiarized with the HIPAA regulations and rules. So you have to be trained with that and you have to be certified, HIPAA certified. So good thing if you apply in HelloRage, they provide free training and certification for HIPAA. Because if you avail that externally, it will be expensive and it's usually paid. So in HelloRage, it's just for free. So let's jump right in for common tasks of a healthcare virtual assistant. So a healthcare virtual assistant can support much more than a physician working at a general practice or hospital. They can work anyone as long as it's a healthcare setup. For instance, psychologists, psychiatrists, veterinarian, dentists, or even a facility that provides physical therapy or occupational therapy services. So we have administrative tasks, we have intake, so they're the ones who are in charge of new patient as well as referrals. We also have appointment setting, so they're in charge of booking appointments of patients and reminding the patients of their upcoming appointment and cancellation of appointment. Then we also have calendar management, so their task is to create a schedule which includes events or meetings, and then we also have organizing files in the database. Also included in the administrative task is email management. So they usually send emails to the patients and to the respective departments in a company or in a facility. And then also there's also a task that transferring physical forms into the database to the EMR or EHR of the company, and also prescription refills. So we have the next task as medical transcriptionist. So the goal of a medical transcriptionist is to document the healthcare encounters. And the physician usually use a system that enables them to record the encounter or the patient's visit with their findings, and they will transmit it to the medical transcriptionist. So it is essential as a medical transcriptionist that you have a good typing speed. And they will then transcribe the encounter into a medical document. So next task is live scribing. So it is also documenting the healthcare encounter by a physician or a nurse practitioner or any other medical professional But the difference is they are with the doctor and the patient on the same room. So they are documenting the doctor's finding real time on the EMR or EHR. So that's the difference between a live scriber and medical transcriptionist. Medical transcriptionist, there's an audio recorded file and they can transcribe it on their allocated time. But for a live scriber, they have to do it real time. So that's it. Our next task is medical receptionist. So just imagine that you have a receptionist in a building. So as a medical receptionist, they greet and attend to the patients over the phone. They answer general inquiries. They also do data entry, and they also do scheduling and also transfer the calls to the appropriate departments. And so that's it. We also have tasks about insurance and for billing, encoding and taking care of the invoice. So getting authorization for the patient's visit or making sure of the benefits of the insurance or they are eligible for the services. So those tasks that I have discussed with you earlier, I hope it can help you understand, give you a picture of how a general task of a healthcare virtual assistant. Of course, they're not limited to those lists that I've shared, and you can also do your own research about it. And as you go along with your task, of course, you will learn more and grow more professionally. And so yeah, that's it. I hope it can help you guys. So that would be all for now. I'll see you on my next video. I hope you guys liked this video. And if you liked it, kindly give it a thumbs up, a like, and a comment down below for your questions and your suggestions. And hit the subscribe button below. I would really appreciate it. Thank you guys so much. Bye.